Thank you for joining us as we approach the anniversary of the first case of the SARS-CoV-2 virus in Nigeria. The Nigeria Center for Disease Control has continued to publish its weekly COVID-19 situation report, providing a summary of the epidemiological situation, the data sheet and response activities in the country. In its latest report 70, the agency says confirmed cases have decreased to 0.45 from 1.6%, and the case fatality ratio stands at 1.2%. While it continues to monitor travels in and out of the country, some travelers have been confirmed positive. Out of over 8,000 inbound international travelers tested, 83 were confirmed, representing 0.9%, albeit lower than last week's data of 0.6%. Similarly, for outbound travelers, 32 out of over 10,000 were confirmed positive, compared to 47 in over 7,000 samples, which tested positive the previous week. Here's more on the pandemic update.
50 additional persons in Nigeria have tested positive to COVID-19 in the last 24 hours. According to the Nigeria Center for Disease Control, the latest figures were reported from 4 states in the FCT, indicating an increase from figures reported earlier. Imo accounted for the highest number of cases with 22 infections. Lagos had 14, 7 cases were logged in Rivers, while the FCT had 5, and Delta logged 2 cases. The total confirmed cases in Nigeria now stands at 254,293. The report also includes 0 cases from Kaduna, Kano, Plateau and Sokoto states. 168 patients have been discharged in the last 24 hours, increasing the total number of recoveries to 230,755. There was no additional death recorded in the last 24 hours, leaving the fatality toll at 3,142. Currently, there are over 20,000 active cases in Nigeria, while more than 4.2 million samples have been tested so far. Lagos State accounts for the highest number of cases on admission, with over 17,000 positive samples, followed by Benue and Nasarawa states. Over 17.1 million eligible Nigerians targeted for COVID-19 vaccination have received their first dose, while more than 7.5 million of the population have been fully vaccinated. In Africa, over 11 million persons have tested positive, while over 247,000 deaths have been recorded across countries on the continent. The total global confirmed cases have surpassed 424 million, while deaths are now beyond 5.8 million.
Persons living with disabilities in Jigawa State have lamented the difficulty in accessing federal government intervention meant to cushion the effect of the COVID-19 pandemic. Chairman of the Joint National Association of Persons with Disability Jigawa State Chapter, Mr. Mohammed Usman, who disclosed this, said most of their members are not enlightened enough to use the internet and register for the federal government intervention.
Partially, persons with disabilities have accessed some part of the interventions. For instance, if we look at the palliatives to do with the food items, a certain percentage was earmarked for persons with disabilities. And a part of that, the most difficult one to assess is the federal intervention that has to do with the registration online, and by virtue of the educational level and socialization of our members, we think that we find it difficult to go to a cafe and register ourselves to access such interventions. So many of our people have not been able to access such interventions, and there are interventions done to women in particular. Some of our members are able to access, about 150 members were able to access such that 20,000 intervention from federal government. And there is an intervention from the National Commission for Persons with Disabilities, whereby we were asked to register our members across the state. But unfortunate, I can say it's very, very unfortunate that majority of our members, I can say many of the local governments, we find out that no single person benefits from that intervention.
Now, should I take the COVID-19 vaccine? Many people around the world still have questions about COVID-19 vaccines. As the COVID-19 pandemic continues, experts are learning more about the coronavirus and virus variants that cause COVID, along with how the vaccines are working. with vaccine hesitancy still a major drawback. Some of the frequently asked questions on COVID-19 vaccines in Nigeria. Joining us to talk more about this is Dr. Nneka Onwu, the Director, Primary Healthcare Systems Development with the National Primary Healthcare Development Agency. She joins us from our Abuja studio. Welcome to the program.
Hi, Millicent. Good evening. It's a pleasure to be here.
Great to have you. Let's begin with questions around the COVID-19 vaccine safety. If the COVID vaccine is safe, why are some people adversely affected by it? And I know there are some people who experience side effects, most people. But in some cases, some have been said to have died after receiving it, and extreme cases of myocarditis, pericarditis have also been reported after the mRNA vaccination.
Yeah, thank you very much. Should you take the vaccine? Yes, you should take the vaccine. Taking the vaccine and really completing, the 2 doses and even taking the booster protects you, your loved one, and your community, from COVID. The safety of the vaccine is something that's not in question. I mean, this vaccine we rolled out last year, March, and we've been vaccinating millions, like the previous update talked about. More than 20 million people have been vaccinated. And if there was a problem with it, would have known by now. But for safety, WHO is the first body. They go through it, they go through the process, how the vaccine was produced, and all the parameters. When we get the vaccines here, and is adjudged safe, we still go through the process. NAFDAC takes over the vaccine, is not released to us, and they go through the same process, checking, whatever the profile is of the vaccine and how it's done, and all the tests that they do at NAFDAC. And that is, and when they certify it safe, they release it to us and we start vaccination. But it doesn't even stop there. NAFDAC continues to check, do spot checks, samples from time to time across the nation in all the vaccination sites to make sure that the vaccines are still, potent. As for, there was a question about people dying. We don't have any such. Yeah, when we take vaccines, anything that you introduce into your body, your people react differently. I take chloroquine, I itch all over. My sister doesn't. People take, even water or Coke, they react differently. So one would expect, even for children, mothers, when they take their children for routine immunization, they are asked to give paracetamol because we know that the child might have a fever. It's the same thing with the vaccine, this COVID vaccine, because when it gets into your body recognizes it as, something foreign. So what does it do? It gears up its fight system to fight this foreign body. And in doing this, it produces antibodies. And of course, if your antibodies are revved up, what will happen is almost simulating as if you have the infection. And the body now uses that antibodies to protect you. So any other time you come across, the COVID, it comes into your body, your system is already geared up to attack it and then, get it out of your system. So those things are expected. They're called adverse events, following immunization. It happens across whether routine immunization or this COVID vaccine. And that is also being monitored. We take data, by NAFDAC, and I think they'll continue to publish and, those data about adverse events. So there's nothing really. And we at NPHCDA also, we collect data on any of the reports. We tell people as soon as you come take the vaccine, should you have any reaction or anything you feel is untoward, please call this number. The number to call is the disease surveillance notification officer who is at that particular local government or ward. So all those things have been set in place, knowing that it's important that our people are very much informed and also protected.
So perhaps, Dr. Onwu, that, in Nigeria we've been better protected, but, a lot of people wonder, are we taking the same vaccines? Is it the vaccines being taken elsewhere around the world that Nigeria is also getting? Because we're really trying to address the vaccine hesitancy, which we seem to have in the country. But I'd also like to ask you, and this is with when you mentioned antibodies that have been developed. Some have said that if you catch COVID and you now have recovered from it, you really have a strong, better immunity, and perhaps the vaccine is not needed. Is this true?
And that's not true. We have tested and you have immunity, but how long does the immunity last? And those are the research that is going on and even going on in Nigeria. So it's important, even after you've had the COVID, to make sure you take, the vaccines. You're better protected. It's a novel, virus, but we know that, that's why we're taking the first dose, second dose, and also the booster. So having that infection does not protect you from being infected. The best thing is to protect yourself. Make sure if you have a house, you have all your doors shut, all your windows, burglary, everything. That's what we are saying. For your safety, take all the doses, the first dose, the second, depends on the vaccine. You take what is required to better protect yourself. That having the COVID, that disease, having it once or not, does not protect you from subsequent, coming down with serious COVID. But you asked about the vaccines, and the vaccines we are taking here are the same things they are taking all over the world. And I think we are very lucky, Nigeria, for having the COVAX facility and the African Union, providing for us, making sure that we get our vaccines at very good rates. We have the AstraZeneca. I think that was the first one we got in here with the Pfizer. And that is the same thing they are taking anywhere you take it, whether in the UK or not. They all have their batch numbers serialized. And that's one of the things that NAFDAC does, actually. When we get the vaccines, they are looking at, the trajectory and where the vaccines are produced, how it has come, and those tests are done. We also have Moderna. Moderna is the same that they are taking everywhere, whether in the US, UK, Canada, wherever. We also have Johnson & Johnson, which is another one that we have. And I think we are lucky in Nigeria to have all this array of vaccines for our people. Why Johnson & Johnson is a bit different, it's a one dose. And it's one of the things we are going to roll out very soon. People take one shot, and that is their, complete dose. The next thing they take is a booster, which will come like 2 months after. But the vaccines are the same. They're the same. We are being produced everywhere, being used everywhere. They are safe, are judged safe by NAFDAC and also by WHO.
Just before we let you go, in a few seconds, can one choose which one they get? Can one choose to take a particular vaccine and not the other?
Yeah, well, it depends on why the choice. I would advise, where you see whichever is available, they're all doing the same thing. It's just the name. It's like asking, do I take Dangote, which is the rice now? Let me not name names. Do I take Arosa rice? Do I take tomato rice? They are all the same. What is available at that time is important that you take it and be protected. You might be saying, I want to take this, and unfortunately, it may not be at that facility at that time, or in a few weeks, and then you now lose out that opportunity to get yourself protected. So once you get there, the vaccines are all the same. Moderna, Pfizer, mRNA vaccines. AstraZeneca is also one of them, but not mRNA. And then it's an adenovirus. The way the vaccine was produced is different, same as J&J. So all those vaccines are the same. They do the same things, that they get your body to respond against the COVID disease. So it's important that you take whichever one you find. They're all safe. We found it safe, and it's good to take it when it's available.
Thank you so much. We've been speaking to Dr. Nneka Onwo, the Director of Primary Healthcare Systems Development with the National Primary Healthcare Development Agency. Thank you for joining us on the program.
Thank you, Millicent. It's a pleasure.
The Imo State government has formally flagged off the community mass vaccination program, taking the ongoing vaccination program against COVID-19 to all parts of the 27 local government areas of the state. According to the governor, Hope Uzodinma, who was speaking at the ceremony, the program is his administration's commitment to combating the dreaded virus headlong and ensure the rate of infection is brought to the barest minimum.
It's the official flag-off of the community mass vaccination campaign against COVID-19 in Imo State. Locals, traditional rulers, religious leaders, health officials, as well as government officials are gathered at the Ndubuisi Kanu Square in Owerri, the Imo State capital, to witness the event. The arrival of the Imo State Governor, Hope Uzodinma, signals the commencement of the activities. First, the State Commissioner for Health gives a report on the coronavirus situation in the state and measures taken by the government to contain the spread of the disease.
At the wake of this outbreak, His Excellency the Governor constituted and inaugurated the State Task Force on COVID-19, ably chaired by erudite Professor of Pharmacology, Professor Maurice Iwu, who championed enforcement, resource mobilization, and supported the various pillars of our state response. A critical mass of manpower in various pillars of response, both at the state, local government, and health facility levels, as well as volunteers, have been trained and retrained, building their capacity to effectively deliver on mandates. This number is well over 2,200.
The story is corroborated by the WHO representative in the state.
To deal with this requires a multilateral collaboration between the religious, the civil society, the health system, everybody. Every hand must be on deck.
Governor Hope Uzodinma says the community mass vaccination program is intended to enable access to COVID-19 vaccines as close to them as their doorsteps.
Because of the signals we received that Imo State is lagging behind among other states who are doing their best to get vaccinated. Today's event, however, signals our resolve as a government to protect the citizens and residents of Imo State against the unrelenting onslaught of COVID-19 pandemic.
In addition to the ongoing renovation of 305 health centers and general hospitals across the state, the government has also provided 10 state-of-the-art ambulance clinics to ensure an effective response and success of the program.
Away from Nigeria, just yesterday, Britain's 95-year-old Queen Elizabeth II tested positive for COVID-19 a fortnight after marking 70 years on the throne. Aides have referred to her symptoms as mild and cold-like. The news comes at a stressful time of scandal for the royal family and after Prince Charles, the Queen's eldest son and heir, tested positive February 10, 2 days after meeting his mother at Windsor Castle. No information was given then on whether Queen Elizabeth had taken any COVID tests herself. She resumed in-person audiences at the castle last week, but complained to one attendee of suffering from stiffness and was photographed holding a walking stick. Well, joining us to talk more about that and other situation in COVID in the United Kingdom is our London correspondent, Juliana Olayinka. Hi, Juliana.
Good evening, Millicent.
Good evening. How are you doing? Just to quickly ask, Julie, the Queen is the most liked person in the United Kingdom. It's no surprise the, outpouring of wishes for her, sadly, after contracting COVID-19.
Absolutely. It was over 24 hours ago. I can even remember myself when I got the alert on my phone. I believe there was a gasp of fear from the entire nation because Her Majesty the Queen, as you said, is very well loved, not by all, but I would say certainly by most. It's been over 2 years since we've been engulfed in this pandemic. She's managed to survive without contracting it, but I think there were certainly fears when we found out about 10 days ago that Prince Charles, as you said, her eldest son, had been in direct contact with her just 48 hours after he tested positive for COVID-19 again. And alas, the monarch has got the disease. According to Buckingham Palace, she is just experiencing mild-like symptoms, as to be expected. When it comes to speculating about the Queen's health, that's something the British media very dare not do. But we have been told that she will be carrying out very mild duties. She is supposed to be seeing Prime Minister Boris Johnson, as she regularly does, on a Wednesday morning before Prime Minister's questions. She will still take that meeting, but it will only be virtual. And I believe there will be some virtual events that are taking place in Windsor Castle this week, and hopefully she will be healthy enough to continue them. But she is 95 years old. We do know that COVID-19 does have significant effects on people that are elderly, but I believe nobody will have the physicians and health apparatus available to her like the Queen. She does have a very senior physician, Sir Thomas Hugh, who will be looking after her in Windsor Castle while she self-isolates. The self-isolation period in the UK is currently 10 days, though that can be cut short if you test negative on day 5 and day 6. And I think the entire nation and royalists around the world will be crossing their fingers and wishing Her Majesty all the best.
But Britain's Press Association said it's also understood that a number of cases were also diagnosed among the Windsor Castle team. What's going on there?
Well, absolutely. We know that COVID is everywhere, unfortunately. Britain has been at the epicenter of COVID-19 across the world, according to the Office for National Statistics. I think early last week, 1 in 20 individuals were testing positive for COVID-19. So unfortunately, it was inevitable that it would happen. We know that the Queen has had some in-person events, as you rightly mentioned. She was meeting some senior Navy officials where she was spotted with a walking stick. And she said yet again that, she was finding it difficult to move. Did anybody around her then have COVID? It's very likely possible, even with a lateral flow test, as you would know more than me, Millicent. You are likely not to show your symptoms until a couple of days after. So yes, there have been a series of COVID-19 infections being spiked up around the royal household, but that's no different to any business or any establishment in the UK.
And about Prime Minister Boris Johnson, I think he is set to announce, if he hasn't already, that is, to end all pandemic legal curbs in England. Tell us what's really happening there. What's the reaction, and will this come to pass, especially with the latest news coming from the royals?
Well, yes, the Prime Minister is currently embattled in a political storm in the House of Commons. I've just been listening to him give his statement where he has outlined the government's learning to live with COVID plan. I think Britain has become an outlier. They're the first advanced economy in the world to do so. And yes, it will still go ahead. On Thursday, all remaining COVID-19 restrictions in the UK will be lifted, which incredibly, astonishingly, means that if you test positive with COVID-19, you no longer legally have to self-isolate. So the Queen is likely to be in the last batch of people that have to legally self-isolate, as you can expect. This has caused some serious concern, not only domestically, but across the world. The World Health Organization, as well as other UN agencies back in the UK, the Labour opposition party, are really concerned about this. And I think the biggest concern for some critics is the fact that free COVID testing will be axed. So for those who do test positive or are displaying the symptoms, you now have to pay for a COVID-19 test. And that is going to be really difficult, particularly those who are on low incomes, those who are working in the care sector, those who just want to make sure they can go about their duties. They no longer will have access to the free test. That is a huge decision, but it was costing the government £21 billion every month to provide these tests. We know that this is causing disarray in the government. At the moment, the Health Secretary, Sajid Javid, alongside the Chancellor, Rishi Sunak, apparently are at loggerheads. We were expecting a statement from the Prime Minister much earlier in the day, but there are still some concerns about whether they should take away these free lateral flow tests. We are expecting a full announcement by the Prime Minister at 7 p.m. local time today, where he will outline this new strategy to the British public. But I've got to tell you, there is a sense of caution amongst everybody, because nobody wants to live with these COVID restrictions. But I think if you're sitting next to somebody on the train who has COVID, you probably won't like that.
Well, thank you, Juliana. We wish Her Majesty the Queen and everyone else rapid recovery from COVID, and do stay safe yourself.
Thank you, Millicent.
Well, Australia fully reopens its international borders to travellers who are vaccinated against COVID-19 after nearly 2 years of pandemic-related closings. Here's more on the global update.
Hong Kong's Chief Secretary for Administration of the Special Administrative Region, Lee Ka-chiu, says the region is confident in beating the current COVID-19 resurgence with great support extended by the central government. Although encountered with obstacles, Lee says Hong Kong's ability to beat the current COVID-19 resurgence has been greatly enhanced with the help of the motherland. On Sunday, Hong Kong registered 6,067 new cases of COVID-19 over the past 24 hours in the current coronavirus resurgence. So far, the Chinese mainland has sent 2 medical teams to Hong Kong to help it fight COVID-19. New Zealand Prime Minister Jacinda Ardern says the country will lift COVID-19 vaccine mandates and other social distancing measures after the Omicron peak has passed, as protesters occupying the Parliament grounds again clashed with the police. New Zealand has reported about 16,000 cases of COVID-19 and 53 deaths since the pandemic began, relatively low by global standards, but an Omicron field outbreak has pushed the country's 7-day average of new infections to more than 1,600 daily cases.
We all would have been worse off as individuals.
What's that feeling like, Bernie?
Australia today fully reopened its international borders to travelers vaccinated against the coronavirus after nearly 2 years of the pandemic-related closings, as tourists returned and hundreds of people were reunited with family and friends. Arriving travelers shed tears and hugged their family members at Sydney Airport and were welcomed with Tim Tams confectionaries. Jazz AOD Vegamite, an essential Australian staple, and stock koala toys.
Charlie, are you talking? Okay.
Finally, soldiers across the United States have been called up to help with COVID-19 testing and vaccinations. About 1 in 5 healthcare workers have quit since February 2020, according to a Morning Consult poll published in October. Last month, officials in stages called on Madison College to ask if they could send National Guard troops in for training to help alleviate the strain at hospitals and nursing homes around Wisconsin. But it's only a temporary fix, as the soldiers are only signed up until mid-March, though the healthcare workers hope they will be granted an extension.
Our website, channelsU.com, has more updates and a better understanding of the pandemic. It's at your fingertips. That's our program this evening. Thank you for watching. I'm Millicent Walker. Stay healthy.